let us discuss about proteinuria. What is proteinuria? If you pass more than 150 milligrams of protein in your urine per day, then it is called as proteinuria. Now, there are different types of proteinuria. Number 1, transient proteinuria. Number 2, orthostatic proteinuria. And number 3, persistent proteinuria. What is a transient proteinuria? Transient proteinuria means you will be passing protein in your urine for a brief period of time, and it subsides over a period of time automatically. What are the causes of transient proteinuria? Well, after a strenuous exercise, you may pass more protein in your urine. Or if you have a fever, then you may pass more protein in your urine. Or if there is any infection like a cystitis, any infection in the body can make you to pass more protein in your urine. And the second type, orthostatic proteinuria. What is orthostatic proteinuria? You will pass protein when you stand up. While you lie down, you will not pass protein in the urine. This is called as orthostatic proteinuria. Now, the third variety, persistent proteinuria. What is persistent proteinuria? You will be passing protein in your urine persistently for quite a long time. This occurs mostly because of a problem in the kidney, like a patient having a glomerular pathology or tubular pathology, or any other disease happening in the kidney like amyloidosis, sarcoidosis in the body can cause persistent proteinuria. Along with that, if a person has got hypertension for a quite long time, or if the person has got diabetes for quite a long time, the person can have persistent proteinuria. Here, the person will be passing protein for quite a long time in the urine, and this requires definitive treatment. This is how a person with proteinuria will be evaluated, and it will be found out first whether that is only a transient cause or an orthostatic cause or a permanent or persistent cause. Now, whatever the cause may be, we can treat it. It is not a case where there is no treatment. We can treat a case of proteinuria. Now, how do we manage proteinuria before we go for medical treatment? What is the way in which we can treat proteinuria before we take medicines? Number 1, take protein in moderation. You should take moderate amount of protein. Don't load your body with huge amount of protein thinking that you are losing protein in the urine. If you are a diabetic person, bring your sugars under tight control. And if you are a cardiac patient having proteinuria, then limit your salt intake, because more of salt intake can increase the problem in the heart, and you may develop cardiac failure, and then proteinuria can worsen. And if you have diabetes, increase your fiber intake, because taking more of fiber will reduce your sugars, and also it will reduce your lipids in the body. So control your diabetes, control your hypertension, control your cholesterol, take more of fiber food, moderate your protein intake, take more of water, and maintain a healthy exercise and good lifestyle. These things can help you to maintain good health, thereby your proteinuria can come under control to a certain extent. And after this comes the treatment. When you have proteinuria occurring in your body, the cause for the proteinuria has to be first found out, and the cause has to be treated. Proteinuria is just like a symptom, like a fever, but what kind of fever is causing the fever to you, what disease or what pathology is causing the fever to you has to be first found out. Similarly, if you have proteinuria, what is the cause which is causing you to have proteinuria should be found out, evaluated, and then it has to be treated. Sometimes there may be causes like heart problem, heart failure. Sometimes there may be a vasculitis or a connective tissue disorder or kidney problem itself, kidney diseases, glomerular diseases themselves can cause proteinuria. So whatever the cause is found out, that cause has to be treated. Now, this is how we treat a patient with proteinuria in allopathy. What about homeopathy? Do we have medicines in homeopathy also to treat a case of proteinuria? Well, just as we treat a patient with proteinuria in allopathy, similarly in a case of proteinuria, the homeopathic management also depends on the disease itself. Whether the disease is a short-acting disease or a long-acting disease, in the sense a chronic disease, basing on that in homeopathy also the medication varies. Now, what about homeopathic medicines? Do we have remedies in homeopathy to treat proteinuria? Yes, we do have remedies in homeopathy also to treat proteinuria, and over a period of time, once the homeopathic remedies are started, the proteinuria can come down and the patient can become better. A patient using allopathic medicines also can use homeopathic remedies for proteinuria. This is called as integrative medicine approach, and following the integrative medicine approach with homeopathy and allopathy would be the best option for the patient because he can draw the advantage from both the systems of medicine. Thank you.